You know, they call you an asshole.
Been called a bitch 1,000 times.
A knocked up whore. Get the F out of his effing room, you effing N-word. I've been bitten, choked, punched in the mouth. I had a guy try to kick me in my stomach while I was pregnant.
You push me past my limit, past my capacity of being able to multitask. Something's gonna get missed. And when I say something, I'm talking about your mother. I'm talking about your father. I'm talking about your husband and your wife.
They may be at breaking point, but their bosses have warned them not to speak out. They are anyway.
So we're breaking news at 6 as thousands of Providence doctors, nurses, and other workers walk off the job. It is a large...
From policymakers to frontline practitioners, we dive deep into the diverse worlds that make up our evolving medical landscape. Join us as we uncover success stories. Whether you're a seasoned professional or simply curious about the future of health, this is your gateway to the uncharted territories of modern medicine. Anas Abidrabu is your host of Uncharted Narratives podcast, Sirdiyat. Today we have a very special guest joining us, a true leader in the field of healthcare safety and security. Today we're going tactical. We've got Mel Cortez. She is fascinating. She has an interesting niche. Are you ready to kind of see where healthcare and security and guns meet? We always think about safety in terms of patient safety, but when you think about tactical healthcare, you've got to think about the providers, the nurses, the doctors, and everybody involved in that care.
Well, with us today, it's been a while. Try to fit your busy schedule.
Thank you. I appreciate it. I'm so excited to be here with you today. And, I love what you're doing in the industry. And so I'm excited to talk to you.
Likewise. Thank you, Mel. So, Mel, what you want to share with us? Who is Mel?
So I am a nurse by trade. I'm a registered nurse, but as a result of the increasing violence at the bedside, I decided that I could either leave and go become a realtor and sell, houses, or I could stay and try and make a difference. So I just picked workplace violence as my initiative to kind of target, because I think that a lot of clinicians get into the profession understanding that they want to help people, and they don't understand that when they get there that we're dealing with patients that are in, the exacerbation of the human condition. And sometimes that can turn out to be really challenging behaviors. We have to treat the person behind the behavior. We're not treating the behavior. And so I wanted to take that clinical and empathetic approach and combine it with the concepts of security and policing and try and figure out if there was a good solution for healthcare security. And then obviously that translated over into schools. And from our consulting company, Cortex Gold, we were able to form a nonprofit TACT book that helps to find the, recommended solutions for preventing violence in healthcare systems and schools.
Interesting. We will get more into details about what you are doing exactly and how you do it and what is your business. It's like you are more into detective school more than nursing. So it's interesting and scary as well. So before we get that, you have diverse experience as a clinical nurse and you have been in different department role. So can you highlight it? Where is the milestone you would like to share with us before you get into safety and preventive security?
Yeah, I think nurses and physicians make phenomenal entrepreneurs. We're always pivoting. We're always trying to solve a problem, and you have to solve that problem pretty quickly when someone's life is at stake. And so I was a critical care nurse for over 15 years and worked at some of the best hospitals in the world, Hopkins, University of Maryland, shock trauma, and as a travel nurse. So I traveled all over, did the COVID pandemic, ICUs and all that kind of stuff on the Northeast here. I've worked as a DON of post-acute care and assisted living and rehab, done home health, hospice, kind of tried to find my little niche in healthcare. And it turns out that I was just supposed to be a healthcare entrepreneur and build businesses that make sense for our patients and for us.
How that come? Do you sleep overnight, then do you come in the morning and say, I need to be an entrepreneur? Or this diverse background, you find something missing in the industry so that to take you? If you can give us more details.
Yeah. Like lots of healthcare entrepreneurs, I saw a need, right? I was like, there's a gap here. There's got to be something more that we can do here. And so that's how I started on my entrepreneurship journey. So nobody in my family has ever run their own business. They think I'm absolutely crazy. They still don't think I have a real job. So I'm like the black sheep in the family that went off and did something crazy. And so I just spent a lot of time using resources that are available. I find that if I'm the smartest person at the table in my boardroom, I'm in the wrong room. And so I like to surround myself with people that are really knowledgeable about the different areas of business. And from them, I've been able to learn and being able to take advice from even online content that's free, right? Whether it's law lectures about business and corporate law, or Gary Vaynerchuk, or, following, Jocko Williams, or, these big people that have really made a name for themselves and been giving valuable content to everyone throughout. And I kind of got, when you have a small business or you start a business and you don't have funding to do that, you have to really learn how to do branding and marketing well. And so I learned that was what gave me the most success in moving forward. And so I got really good at that. And then companies started coming to me to ask me to help them enhance their value proposition to the healthcare vertical, which is a really difficult vertical to scale. And that was really because everything that I innovated, I wanted to make sure that it was able to help meet the needs of these organizations, whether it's staff retention or enhancing the brand and visibility of an organization, all the way down to the physical safety of their employees.
Yeah, you mentioned right now something I like it, and I want to ask you more about that before we get your business. You mentioned that you discover you are in the ring room when you are the smartest one in the boardroom. When and how you realize that?
I think it's a humility thing, right? Like, I think the best people in business are the ones that stay humble. If you understand that you're starting a business to make money, that's great. You might be successful at that in a short period of time. But if you understand that you're starting a business because you want to make a difference or you want to serve other people, the money will flow. I have a colleague that always says revenue flows to quality. And so when I realized that I'm expert, if you drop dead right now, I could save your life, right? I'm really great at that, but I'm not great at, looking at business partnerships and strategic things until I learned from someone. And then I was able to acquire that skill. And now that's something that I love to do, so I think that by surrounding myself with really smart people, I realized I was going to go further. And when I first started in my business journey, I was under, mentoring or under a mentor of someone who didn't accept that advice. They really didn't listen to the members of the board. They wanted to kind of plow through in their own way. And I saw the negative outcome of how that affected him and his business and the way that he moved forward. So it made it clear to me that, like, okay, this is a good example of what not to do. And then in healthcare, I, had bad management or bad leadership, and I saw what not to do and the type of leader that I wanted to become. And in healthcare, I think sometimes we get really siloed and we look at only healthcare. And I was really encouraged by reading things like Objectives and Key Results, the Google strategy, and looking at other industries and how we could take information from those industries and put them into our practice.
You keep me thinking more about question it was in my plan to ask, but someone like traditional nurse, the stereotype of the nursing, they are educated, highly educated,
Yeah.
they take the lead, but most probably they think about patient safety, improvement more into what is the trend in the medicine. So it's look like you are out of the crowd and start to see other industries. So what make you to think, okay, good, in order to do this in industry, the healthcare industry, I need to see, for example, Google, like what you mentioned, and their strategy. So from your perspective in that time when you started, what make you feel this is the right way?
I think I was frustrated with the lack of progress that I was able to make in the healthcare system because they weren't innovative, because they weren't looking at other ways to make things work. So I got really frustrated by the lack of, movement, the resistance that we were facing. It always feels like an uphill climb in healthcare, no matter what you're doing. And to me, that just didn't seem right. I said, how can Google or these big technology companies progress so well? And I realized it's because they take a different format to what they're doing, whether it's because they're doing, their project management things are different, or because they're, having scrum meetings more often, or because they're doing different types of, leadership development, or they're looking outside to other industries. And I think I've probably heard it on a podcast somewhere, or heard it on a piece of content. I've been following Gary Vaynerchuk for a really long time, for like the last 10 years, and just kind of listening to him and what he says about social, and that, attention is really valuable, and just learning to accept. The greatest piece of advice I ever got was, when you talk to somebody else who wants to give you advice, take 10% of what they say and apply it. And then for the other 90%, do whatever feels right.
During your growth and your transition, you were connected with other people to learn from them as a mentoring process or mentoring journey. So now we are in the trend of coaching and mentoring, especially from the nursing industry. And there is a lot of some with the coaching and some with not. However, from me as a coach, I see this is overuse and misuse of the coaching.
Yeah, and they're charging millions of dollars to nurses, or $25,000, $30,000 for them to start some business. And really, they're just, giving them the format to do it, when you could have went to Google and figured that all out by yourself while you're working a night shift and, reading and absorbing content. So I think that there's a lot of value for a coach like yourself that streamlines to what the person needs, and isn't trying to like profit, make millions and millions of dollars off the coaching business. They're doing it because they want to provide a service to people, because they think that nurses are excellent entrepreneurs. So I think there is a lot of, like, I'm the type of person that, of course, on my consulting side, if a business is coming to me that has revenue and they're selling, like, I'm going to charge them for that. But a lot of times I've helped many nurses just, hey, before you hire a business coach, or if you want to hire a business coach, let's chat so you can find the right coach for you.
Yeah, and this is where you want to make sure before you start to know this is the right match for you. So from your experience, before you hire that coach or mentors, did you go through what you need and what you need from the other side to give it for you? Is this something what you did in the past?
I think that sometimes you don't know what you need, because that's why you're hiring a coach, right? So a good coach is able to make that quick assessment to figure out where the gaps are and whether they can meet those needs. Sometimes you have the business asset or you have the money to do it. You just don't have your life together enough. So maybe you need a life coach that's going to help you, learn to get up in the morning and eat well and take care of yourself so that you can be nurse and mom or dad, as well as run a business. But sometimes you've got that under control. You just don't have the business acumen to understand, how a market works, or how do you acquire clients, or how do you talk to people. And so sometimes that's the coaching you need. And I think that's up to a really good coach in their introduction with someone to figure out if they're the right client for that.
Before we get into your business, all the time, especially from where I came from, the health tech companies, when we mention safety, we more focus on patient safety and the solution, how to improve it. But physical safety, it is a little bit rare. So what does it drive you to be out from the crowd and go for the physical safety?
Well, so when I was a nurse, I worked in Baltimore City, which is a really violent city. And so saw a lot of violence, whether it was sexual assault all the way to I've been held at gunpoint before, just crazy stuff. But there was a particular incident as a result of violence that the patient, another patient that I was responsible for, ended up passing away because we could not get to them to change their critical medication. And to me, that's where that nursing kicked in, like, I have to protect my patient. So really the root of everything started in patient safety. The fact that, as a result of violence, the patient, passed away. We had an adverse event there, a sentinel event. And so I said, this, I can't be the only person that this is happening to. This has to be happening. And so as I started looking into the information, I realized that organizations that don't prioritize the physical safety of their staff also had really low quality and clinical scores. And so what the trends were correlating. And so I realized that in order for us to make any headway in the patient safety sector, we needed to invest in nurse safety and clinician safety first. Because without, you look at Maslow's hierarchy of needs, and the number one thing is physical safety, shelter, food, and safety. And if you don't feel safe, you're not going to be able to do high level critical care or critical thinking nurses are required and doctors are required to do.
Well, it does make sense already. When you are feeling safe, you will be more productive, innovative, and feel giving for everyone, and especially for the patient. So if you are not,
Exactly.
so you will think how to be secure about yourself and about your patient as well. And while I'm doing my research about you, I found a lot of where you are driven by data and number. So based on what you has mentioned right now, the combination between the physical safety and patient safety, and when we have a good orientation or a good understanding about physical safety within the hospital, we have a high quality. However, from my experience as a nurse and as one who worked in the incident reporting software solution, this is not common. So how you start work with the quality department and patient safety department to not everyone work in a silos, to have a joint work for a future vision.
Exactly. I think that when we look at hospital operations or clinical operations, I see it in three different sections. And that really comes from my understanding and studying of the counterinsurgency manuals from, General Mathis and Petraeus. And so when we looked at trying to stabilize a region or trying to support a region, there's offensive solutions, defensive solutions, and stability solutions. And so anything in healthcare goes into that. So if it's clinical, they can be in all three of those, right? Clinical staff are trained to observe and assess and to be alert all the time. So we can train them not only to be assessing about patients, but they can also be our best risk assessors or our best threat assessors as well, and to determine if somebody has a potential for violence or if somebody has a potential to have challenging behaviors because of their clinical diagnosis, or that also turns over to quality. If you're looking at sepsis, if you're looking at clinical indicators, if you're looking at sentinel events or falls or whatever the thing is that you're tracking, you will see a correlation if you're collecting the data appropriately into the physical safety and the signs and symptoms of, potential challenging behaviors that lead to violence.
I hope all those departments which you mentioned, they are working together, but in the reality, they are not.
They're not. And I think that's where hospital leadership is the most important champion, right? If all organizations have to have a chief nursing officer to operate. And when I talk to chief nursing officers and CEOs, I tell them, you have a duty to your patients to keep them safe. If we know through correlating data and evidence-based research from all around the world that we know when you don't have physical safety for the nurses or priority a culture of safety inside your organization, you will have poor clinical outcomes, then you really do have a obligation to prioritize that from an executive level approach. And I think sometimes a lot of executives, these guys are talented folks. They could go work in a Fortune 500 company that's not healthcare. So a lot of them do have that altruistic perspective. They really want to do something. Maybe it's a parent who died of cancer, and that's why they became a hospital CEO. There's lots of good stories out there. So I think that when we understand that and we appeal to the human side, right, to the empathy people have in working in healthcare, we can make them understand that prioritizing these things and de-siloing or de-sectioning your departments is the best way to move forward. It's just sometimes they need help with that strategy. How do I do that? How do I make that?
Now, we know who is Mel, someone crazy, like to advocate for the patient and for the healthcare system overall across with all healthcare providers. Let's get more into, let's spice it up with your business. So tell me about your company and the name of the company and why you choose this name. You are wearing your t-shirt, right?
So Cortex Gold originally was our consulting arm. That's our for-profit arm of the company. And this is where we go into VC funding boards and people that are buying hospitals or, executive leadership. And we kind of tell them, hey, here's our gap analysis. This is what we see. And these are the ways that you can de-silo those departments and work together, right? Here's the strategy to make all this happen. And so picked it because, my last name is Cortez. And the cortex of the brain is the largest site of neuronal integration. So there is where everything fires and connects. And so to me, when you're looking at reducing stress, enhancing corporate values and enhancing corporate, perceptions by your staff, understanding how to correlate and work together It just came from that really neuroscience-based mindfulness portion. And then gold, obviously, how do we make all that profitable, right? How do we turn something that traditionally focusing on patient safety or staff safety has been something that takes revenue from the organization, that's an organization money. Our whole thing is by using evidence and data, like you said, we're very data driven, finding the research and doing the surveys and collecting the data from cross department, not just nurses submitting, hey, I was assaulted this week. It's more of, hey, our quality scores are here and we have this amount of call outs. And then, we have this amount of supply chain issues per department. We can look at how we can enhance profitability. And so GOLD is an acronym, and it stands for Guiding Organizational Leadership to Deliver. And then we talk about what we're going to deliver. And that's usually solutions to some of healthcare's most complex.
Yeah. And you just start in last year.
Consulting business, the Cortex Gold was about 4 years ago. So we've been doing consulting for 4 years, and we consult for organizations, we consult for tech companies, we consult for other people that are trying to scale the healthcare vertical. And then on our nonprofit, which is probably my favorite thing to run, is we help organizations to get to the best solutions, whether it's people, predecessor, or consultant processes. So again, those policies, those procedures, those SOPs, and the training, or tools, technology solutions, things that will help them along the way. So people, processes, and tools that will help them be successful in preventing violence in not only healthcare systems, but our school systems. Because in America, we have a really difficult problem with gun violence, and it is a public health emergency.
And you're living in Texas already.
Yeah. And I live in Texas, where we're proud of our guns. And so I like to tell people all the time that don't understand the American dynamic, guns are not the problem. People are the problem, and public health is the problem. Our mental health resources are very poor here. For instance, in the state of Texas, we have the 8th largest economy in the world, but we're only first in the nation for mental health spending. So we've got all this money, it's just not going to mental health. And it's not because people don't want to put it towards mental health. I think it's they just don't know what to do and how to develop those systems. So part of the goal of the book is to provide the training. Is an acronym for tactical approach to caring training. So again, rooting any type of challenging behavior management into empathy, into taking care of the patient, and then keeping that patient-centered focus. Because we know for clinicians to have any buy-in, it really does have to be patient-centered, because that's why we all get into this industry, is really to help people.
TACT book, it's part from your nonprofit arm?
Yep. And so a lot of entrepreneurs, when they first start off, they don't really understand, what type of corporate entity should I even set up? Do I need an LLC? Do I need an S Corp? Do I need a C Corp? And so one of the models that I really liked was having a for-profit company and a nonprofit company, because it allows you to help. Nonprofits are designed to help connect the public sector. So public things are anything that's funded by public funding. So tax dollars, your school systems, things like that. And then profitable our for-profit companies are the private, private big industry companies like Apple and things like that. So how can a nonprofit is designed to connect those two. And it's really what we need in order to cross the divide between legislation and public entities, and then actually putting the technology and solutions in place to protect our schools and healthcare.
I'm surprised by you. It seemed like you are also have a little bit here financial area.
Yeah,
in your
well, when you run a business, you have to learn all that, right? And that's not something like, honestly, if you told my mom that I was like, that's why my mom has a really hard time believing I run a business, because back in the day, my checkbook was always off. I was always I had a hard time with that. But I think fiscal responsibility is something that definitely is a skill set that we have to learn how to do in entrepreneurship and going forward. And again, just finding really smart people to help you manage and to help give you the ideas.
How is your business? How is the structure for your business? And I believe during your journey, you identify the gap in healthcare sectors and where you will added value, where this area is untapped. So you touch base that, but give us more details. What exactly you do with the organization? Let's assume we are a big hospital and we need to hire you. How you will work with us? What kind of training you will do with us?
Yeah. So the first thing that I usually do is, when we go into a hospital, we talk to the board first, and whether that's because they really do hold the purse in the American healthcare system, and they decide where that money goes. And so I try to understand if they're having problems with profitability in different areas. And then from my clinical experience, and I may bring in an advisor or somebody that's an expert in different areas. That's the best part about having a nonprofit is we have a network of over 40 advisors from around the world that do all kinds of things. And so based on our assessment, analysis, and chatting with people, then we determine where we need to target. Is it the fact that you just are really violent and we need to provide immediate, threat and help with threat assessment and securing the location? Or maybe you need executive protection to the C-suite. So we have folks that are experts in healthcare executive protection or school executive protection. And we may look at maybe you have a clinical or quality problem and your CQI scores are off. Is there somebody that we can find in our network that we work well with? And is there a strategy that we can use to enhance quality in those departments? Maybe it's retention and turnover. The idea that you have on your brand and your mission and vision, when we do a staff survey, which is usually, step number 2, we kind of put out a survey to the staff to kind of figure out where they feel about a culture of safety. And maybe the brand and the mission and the vision that the organization has doesn't translate over to the people that are employed there. And so we work at enhancing the employee value proposition, and we bring in some experts that are really good at that with branding and marketing and strategy to be able to recruit and retain the staff that's inside. Because we can train all day, right? We can train people all day long, but it doesn't matter if you train them if A, they're not competent in the training, and B, if they don't believe in what you're teaching them and want to use it. And so that's what culture shifting is about. In healthcare, a lot of times people get into the profession and then they're shocked at how hard you have to work, how limited the resources are, all the insurance companies and the whole system is really broken. So it discourages people and they want to leave. And so the best part about an organization, it's like being part of a family, right? When you go out, even though your family's going through some tough stuff, you don't abandon your family. They're your family. And I think there's a fine line between using that as a way to keep people in a toxic environment, say, well, you can't abandon your family. It's more of, hey, we're a family and we're going to work towards being better together. And this is the strategy that we need to do that, whether it's from the C-suite all the way down to your ancillary, personnel, the people that are environmental services, cleaning the rooms, people that are feeding your patients, all the way down to vendors and people that come into the organization. So we create a culture that understands that we are in this together, and these are the mission and the vision and the values that we truly uphold. Because you can post them up on the wall all day long, but if you don't live those core values or you don't have representation at the bedside of those values, you're not going to get anywhere. So that's where the training element comes in. So I wanted to have, with the nonprofit and the for-profit side, I wanted to have long-term success, right? What are the things that we can do to help legislation? What are the things that we can do to help with federal, funding and federal opportunities? But at the same time, while we're working on all that, which takes a long time, what can we do immediately to help you and me from getting punched in the face, right? And so the training component not only teaches how to prevent violence, how to see the violence coming based on nurses' skill sets or physicians' skill sets that already exist. So I'm not trying to take a nurse or doctor and train them to be a police officer. Like, that's not what we're doing. How do we enhance the skill set that they've already developed to become a threat and to avoid the threat? And then when the threat is imminent, how we train them to manage that threat and not be afraid in the environment to enhance professionalism training. So a lot of what I was seeing was that the nurses and doctors, the experienced ones, have really left. So all of the things that we learned from observation and watching, the older seasoned nurse or the older seasoned doctor come in the room and deal with the patient conflict, they're gone, and we look at the generation of people that are out there, they're on their phones all the time. We weren't allowed to have phones on the unit when I was a nurse, right? You had to lock it up in your locker. Now they're constantly on the phone, so there's no situational awareness. And then when patients come over, it looks like they're doing their job, even though they're probably been working all morning and they just have a chance to sit down and, check their Instagram feed or whatever. So I'm so proposing of no phone zone, right? But I think that we need to understand what is our ethical and moral obligation to our patients while we're there. And that's where we look at other things, like, is a 12-hour shift really too long for someone to work? Like, should we start moving to 10-hour shifts? Or is there a way that we can have supplemental or flexing staff? What are the ways that we can help, or leveraging AI, leveraging technology to workforce management? Are there ways we can enhance the things that we're already doing in a low-cost way, and also providing the training on top of that? Helps save their life. It helps enhance their professionalism.
When you go for the hospital, you start with the board, with the leadership, and try to the strategy.
Yep. We have to start with the board, even above. I prefer to go to the, above the executive board, to the funding board, because ultimately those guys are the ones that are making the decisions about where the money goes. And I want to understand where their long-term vision is and what I can do to enhance the organization. Because ultimately, whether we'd all love to go put Band-Aids on everybody in the community for free. But healthcare is a business and you have to run a business. So if we can help enhance the business first, then everything else will flow down. Like I said, revenue flows to quality.
After you build this step by step and the future strategy and the plan with the board, so day-to-day tactical, who is the typical person working with you during your project?
Yeah, so we utilize veterans. So, I was married to an infantry Marine for a very long time and saw, the community of veterans, and saw that when they leave the military, they have a really great skill set that we just don't capitalize on, and it doesn't translate well into civilian life, right? And so we use them as tactical reps. So they come to the nonprofit. They come through a 6-week funnel where we train them on healthcare or schools, depending on where they're going to go. And so say we meet with the board, right? And you're like, look, we really need enhancement and security, and we need a police department, and we need, 50 guys, or we need 25 people, supplemental staff. We'll go out, recruit for that organization, put them through a funnel, train them, and then they'll come out and they'll serve as the tactical representatives in those organizations. They can train employees live on, at operational tempo, and they can also provide security, and they can also help assess for threats and other things that are going on. But again, they are all trained in professionalism training as well. So they might, help coach some nurses that, challenging interaction with a patient and say, are you stressed today? What's going on? Are you having a bad day? Is there someone else you can tap out with? Trying to have an empathetic approach to the fact that they're in a stress system too, and we have our own lives and we have our own things that sometimes we bring into work, and that's sometimes unavoidable. And I don't think we should be faulting our employees by being human. And we're also taking care of other humans who are probably having some of the worst days of their lives.
We've covered some incredible ground today, but our conversation is far from over. In our next episode, we'll dive deeper and explore even more fascinating insights. Stay tuned for part 2 of our conversation on uncharted narratives. If this episode sparked something in you, here's how you can keep our mission alive. Subscribe to Uncharted Narratives Certiat. Leave us a 5-star review. It helps more amazing people discover our stories. Share an episode that moved you with a colleague or friend. Connect with me on LinkedIn and join our healthcare innovation community. Together, we're not just telling stories. Until next time, stay curious, stay passionate, and keep pushing the boundaries of what's possible in healthcare. See you in the next episode of Uncharted Narratives Certiat.